Hi everyone, welcome to Talking Life with Macy. I hope that all of you are doing well. I know that certain parts of Klang Valley are under EMCO, so please stay safe. Now, today is a trending and very hot topic we're talking about. We're going to talk about vaccines. So, what you should do when you're tuning into this is please share this with your friends, with your family, with people who are unaware or refuse to take the vaccine. It's a very, very important thing to do. So please, please, please share this on your WhatsApp, on your social media pages, because I'm sure everyone has been asking questions about vaccines and all types of questions about vaccines. Like, for example, if you're pregnant, should you take the vaccine? If you have asthma, should you take the vaccines? There's just so many questions on the vaccines I've had seen in the past few weeks when we have Talking Live with Macy. So please go ahead and share this. It looks like we're 15 people already, and that means that there are a lot of people interested in today's session. So welcome once again to Talking Live with Macy. If you have not been on this show actually focuses on medical, health, and wellness topics, important topics and trending topics that we talk about on a bi-weekly basis, or I try to have it on a bi-weekly basis where I have experts to join us and who knows all about the topic at hand on that particular day. So if you want to find out more, stay tuned to my Facebook or Instagram page on Fridays and you will know what topic is coming out on a Sunday. So today's topic is a topic that is trending not just in Malaysia, but worldwide. We're going to talk about vaccines and all of the different types of vaccines or any questions that you have about vaccines, because I know you have a lot of questions about vaccines, be it side effects, if you have a certain condition, can you take it, and where is it available, and what is available. So all of these questions will be addressed today on Talking Live with Macy. And that's why you should share this video with your friends, family, and on your social media. Because believe it or not, there are still many people out there who refuses to take the vaccine. They don't believe in it. And more importantly, there are some people who actually don't believe that COVID-19 exists. So that is a big question mark for not just for me, but I feel like it is for everyone who thinks that way. So please, I would like to ask you to share this with people that should know about vaccines, vaccination, being inoculated, why it's important. So today we have a special guest who is also a recurring guest on Talking Live with Macy. He is the managing director of the National Cancer Society of Malaysia. He is doing great work regarding vaccines here in Malaysia. And as you know, I've mentioned it earlier, in certain parts of Klang Valley, we are under EMCO. Malaysia has not been going down. And I know that cases are increasing worldwide as well due to the Delta variant. So Dr. Muralli, the managing director of NCSM, has been actually going on the ground to give out vaccines. He will tell us more, hopefully. And if you have questions, what you should do is start putting them in right now. We're going to pick them up at the end of my session. After all my questions are done, we're going to pick up your questions. So please start putting in your questions regarding vaccines to Dr. Muralli. So we're going to jump straight into the questions because I know you guys want to know more. So hi, Dr. Muralli. Thank you for joining us.
Hi, good afternoon. Thank you for having me on. As usual, always a pleasure.
Good afternoon, Dr. Muralli. So I'm going to jump straight to the questions. Could you briefly explain what are the differences in terms of the vaccines available in Malaysia?
Okay, so first off, we've got different types of vaccines. Okay, so largely you have now three different big groups. Okay, so the first is your mRNA vaccines. So your mRNA vaccine, the most famous, of course, is your Pfizer-BioNTech. It's a 2-dose vaccine. What's different in terms of an mRNA vaccine? It's the fact that unlike a conventional vaccine, where in a conventional vaccine, okay, what you usually get is you get either a whole part of a virus or a microorganism. I'll just say virus because it's easier in the context of COVID-19, right? So you get either a whole piece of a virus or you get bits of a virus, something which is cut up in half or cut up a quarter. This is what is injected into your body. Okay, so the virus, of course, is sometimes it could be a live virus, or most often it's a either inactivated virus or a dead virus. This is a traditional vaccine. Okay, and what is a traditional vaccine today is that we have within the Malaysian context is Sinovac. Okay, so generally, like Sinovac is how all vaccines have kind of come out before this. Okay, now and I was telling you now about your new kind of vaccine, so-called new lah, your mRNA vaccine, Pfizer. What is different than compared to a normal, like old school vaccine, or like a Pfizer mRNA vaccine is this. In an mRNA vaccine, what you're doing is you're actually putting in a piece of a messenger protein, okay? And this messenger protein, okay, is injected into your muscle cell, and it tells your muscle cell to create a spike antigen. The spike antigen is actually an identifying part of the COVID-19 virus. So you don't need to put in a whole COVID-19 virus which is dead, or you don't need to put in part of a COVID-19 virus which is dead. What you're actually doing is you're sending in a messenger protein into the recipient, which is the person into whom the vaccine gets injected. Into this person, you're actually giving an instruction. Okay, and you're telling that person's muscle cell, please produce this protein. This protein is actually a COVID-19 protein. Okay, and that actually triggers your immune system to kind of make out all your kind of B cells and T cells and everything else that kind of makes up the immune response. So those are mRNA vaccines, second group of vaccines. So I talked to you about old school vaccines. I talked to you about mRNA vaccines. And the third kind of group is viral vector vaccines. Now, viral vector vaccines are actually I would say equally as sexy as your mRNA vaccines, simply because it's very new technology, very exciting. What in a viral vector vaccine, what actually happens is you have a flu virus, basically an adenovirus, so it's a live virus. Okay, within this virus, they have already changed the DNA, and they have coded for the COVID-19 protein again. So this virus transmits into your body. That's what's injected as a vaccine. Infects your muscle cell, goes into your muscle cell, and does the same thing, which is it tells the muscle cell, instructs it to make the same similar spike protein, which is a COVID-19 protein. That then gets out of the cell, goes into the blood circulation, and induces an immune response. So these are the three big groups of vaccines. So you have mRNA vaccines, viral vector vaccines, and you have your old school vaccine. So your viral vector vaccine is, of course, AstraZeneca, and the newest viral vector vaccine is CanSino. It's been approved in Malaysia as well. It's more interesting because it's only one dose. And the second within that group of single dose vaccines is Johnson & Johnson, also approved. But Johnson & Johnson we may not see in Malaysia for a while, because there's no arrangement for the government to have it in as yet under the supply. So yeah, your three groups of vaccines.
So there are three groups of vaccines to everyone out there. To recap, Dr. Muralli mentioned we have Pfizer under the mRNA group, and then the viral vector is AstraZeneca and CanSino, which was just approved, and also Johnson & Johnson, which is one dose as well. And the final one is Sinovac, which is the traditional method of producing vaccines. So we have three groups now here in Malaysia. And I believe most of the vaccines in worldwide actually falls under these various groups. I know that some of you are watching from Indonesia and from Singapore. So it's good that actually some of the vaccines mentioned by Dr. Muralli are also available in your countries. So now my next question is, can cancer patients take the vaccine? I've gotten this question so many times.
Okay, so very interesting. Okay, and I've got, I think, I don't know whether you're aware, I do this Malay show called Kisah Cancer every month as well. So Kisah Cancer this month was exactly that. So originally, a lot of people, including cancer patients, of course, had this concern. Now, what they did is you got oncologists to kind of look at the kind of vaccines and see whether they harmed cancer patients. Okay, and of course, within the cancer patient packet, it's very heterogeneous as well, very dynamic. You've got people who are just diagnosed with cancer, just undergoing surgery. You've got those set of people who are getting chemotherapy, or radiotherapy or immunotherapy. And then you've got those packet of people who are just finishing treatment and going into remission. And at the same time, you've got those people who are treatment free for, like, say, years and years. So you've got this whole very big range of people. So we looked at things like whether, two questions, whether by putting the vaccine into you, okay, would it cause you to get an adequate immune response? Very important question. Okay, because if I injected you and you didn't get an immune response, there's absolutely no point in me giving you the vaccine, right? So that's the first question they needed to address. And the second question, which is equally more important, is whether by giving you the vaccine, did I then cause your cancer to get worse? And this is an equally worrying kind of question. Now, the good news is, for the second question, equivocally across all sets of like cancer patients, people on active treatment, people off treatment, finished treatment, different types of treatment, the answer is no, 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 no. So there's absolutely no evidence up to now. And I think if you look up I urge people to go and look at something called the Bloomberg Tracker. The Bloomberg COVID-19 vaccine tracker is live every day, and it shows you globally how many doses have been given of all the different types of vaccine. And we're crossing more than 3 billion doses. So that's really a lot of data, a lot of packets of cancer patients, and within that in different countries. And the answer is coming back to us: no, it does not make your cancer get worse. So that's a very important kind of finding, which actually gives us the kind of courage to tell cancer patients, look, don't worry, your cancer will not get worse. Now, the first question, coming back to the first question just now, which was, now, will it make me actually become protected against COVID-19? Now, within this, it's a little bit of a more kind of careful thing that we need to see. What we found is, when people are on active chemotherapy, okay, as well as immunosuppressant therapy and a lot of your treatment for hematological cancers, okay, then they find that when I vaccinate you at that time, okay, you don't seem to get an immune response. Okay, so which means me injecting the vaccine is just expensive water lah, so then the idea is, and now we've got quite good data coming out, that when you switch them off chemotherapy, meaning they finish chemotherapy, or you give them a gap in which you give them the vaccine, they actually get a strong immune response. There are now 2 big studies which have been done very specifically on cancer patients, which ask this question on when I vaccinate a cancer patient. And so far the data is Pfizer, I will tell you. There's secondary data from the UK, big data as well. It's a couple of million people. And within that, there's quite a big pocket of cancer patients. So within this pocket, what they did is, for cancer patients on any kind of treatment, that was the first study, you gave them the vaccine and then you tested their blood to see whether they got antibodies or not, and how long that antibody is lasting. So very good news is, you got antibodies were more than adequate, and it lasted. Okay, and the data for this was largely driven by Pfizer, meaning a lot of these patients were on Pfizer simply because they were American patients, and no other reason for that. Okay, and because of that, one of the kind of things that we've been pushing is, okay, let's get people either Pfizer or AstraZeneca, because the second big study I was telling you about is data which is coming from Britain, from the UK, and that data is largely Astra driven. So we have tried our best to kind of remain true to the data. And the good thing is this: I've been telling everyone, somebody's going to kick me off an European travel list because of this. Usually, the Angmos are the ones getting tested. Usually we are the ones getting tested, and they run all these clinical trials in poor countries, the kind of story, and we become the guinea pigs. This time, they have become the guinea pigs for us, and we in Asia, specifically like in places like Malaysia, we are now seeing the benefits of the data. So other people already kena cucu, suffer already, everything. Now the data is safe, so it's good enough to use. So with the exception of people on hematological cancers, certain types of treatment, and of course chemotherapy, everybody else, take the vaccine immediately. For this packet of people, your oncologist or your hemato-oncologist will kind of space out when you need to get the vaccine, but they get the vaccine as well.
So bottom line is take the vaccine if you're a cancer patient survivor, unless you have lymphoma, leukemia, the blood types of cancer, and whether you're on chemotherapy, then your oncologist will advise you. So the
Yeah.
most important is if you're a survivor, please go and take the vaccine and a patient. And in are certain types of cancer survivors not advised to take the vaccine, or all cancer survivors should take the vaccine?
Yeah, so as I was telling you, the data is quite clear now. There is no group of person who's actually not eligible to receive the vaccine unless they have this history of anaphylaxis, in which they'll really like kind of really carefully look and measure, work out through immunology, and then only give you the vaccine. Even then, it's not like don't give you the vaccine. They're like figure out which vaccine is safe for you to give, the different strategies to give you and all that.
So that's a very clear message from Dr. Muralli and from the data that he has studied and actually it has been presented worldwide that you should take the vaccine and to not be afraid of it. So the next question is, I've heard this so many times as well. There's a lot of hearsay stating that Sinovac has the least side effects and majority of people actually want to take that vaccine. Is that true? Does it have the least side effects?
Okay, so I'll tell you a little story, and this is, I suppose, very kind of average for every Malaysian family. So I've got members of my family who got Sinovac, some people got Pfizer, some people got Astra. So they are like, for example, my mom and dad both got Astra. My dad is a little more of a not well person, and he absolutely had nothing on the Astra. He was like jogging back to his jogging on the same day of getting an Astra shot. My mother was much more a well person. She was done for like 3 days. So similarly, our understanding of old school vaccine like Sinovac is, oh look, it's most probably going to give you a lot less side effects, simply because it's an old school vaccine. And it's not a kind of live viral vector vaccine like Astra or something like that. But I've got family members who had nothing from Sinovac. I've had people who had fevers for like about a week with Sinovac as well. So again, so it's very much an individual response, so I wouldn't. So if you're going to take Sinovac simply because it has less side effects, that may not be true for you specifically as an individual, because really until you take you won't know. But I don't think there's a difference between any vaccine. So whatever you get, the best vaccine is that which gets into your arm first.
So true. So the most important is it's not true. Those questions that you have about Sinovac having the least side effects, it really depends on your own individual immune response, as Dr. Muralli mentioned. Yep. So please take note of that. I know many of you still have questions, so start putting them in. I have about 3 more questions for Dr. Muralli before we go on to all of the questions that you guys have. So Dr. Muralli, the next question I have is, would you advise everyone to take the vaccine regardless of any diseases or underlying medical issues they may have?
My message is to that is actually is totally the opposite. I'm like, if you have a disease, you take the vaccine. If not, means you're going to die if you get COVID. It's as simple as that. So every day, if you look at your KKM punya statistics that come out, now people wait for that, like waiting for lottery number. I remember when I was little, we used to live in a small town, and you could see the same row. You'll have the Toto, the Magnum, and whatever the other thing is. I think Damachai. It's all on the same row, just a few doors from me. About five something, right? The entire world will be waiting there, for the results. That time no internet, this is like the 90s, So nowadays I notice the same thing. Everybody's like crowding around waiting for that 5 something when KKM releases the statistic on how many cases per day. Sad lah. Anyway, so if you notice from that chart on the right lower corner, there's always a kind of breakdown of those who died. And if you notice, they always tell you how many had comorbids and how many didn't have comorbids. And increasingly, when you see now like big death tolls every day, 100 over cases, 100 over deaths, and overwhelmingly, you can see most of them had comorbidities. 70-80% of them are people who had comorbidities, some kind of comorbidity, diabetes, cardiovascular disease, hypertension, cancer, whatever it is. So, and we know very early on, I think in about February, March 2020, we already got quite a lot of data, and at that time we really cautioned people that, look, if you have a comorbid disease, your likelihood to get COVID is much worse, okay? It's much higher. And if you do get COVID, you get a very, very worse type of COVID. The likelihood for you to get into ICU higher, the likelihood for you to get intubated higher, the likelihood for you to die is higher as well. So having all these diseases, you still don't want to take vaccines. Wow. It's like, yeah. So really, it's you're just so much more at risk. It's how to say, the numbers don't even compute. It's just not safe.
Okay, so there will be no underlying health conditions, none at all, for people to avoid taking the vaccine, right?
Absolutely none. So the government has issued this 100 over pages in your guidelines. They've looked at all the data as well. And if you look at it, with the exception I was telling you, right, if there's a very, very small specific group of people who are allergic to vaccines themselves, okay? So with the exception of this super small group, everybody else, take.
Okay, so take the vaccines. My last question for you is, what would be your advice to everyone when it comes to the vaccines here in Malaysia generally and against the Delta variant?
Oh, okay. So what is good is, okay, and here again, we're seeing data from things like settings from like the UK, from India, and of course from the US. So in the US, most of the vaccines being used are Pfizer, okay, and we don't have as many Delta variant cases in the US, but you're seeing that they have lab studies to show that it works against Delta variant. Similarly, Astra has shown quite a lot of effectiveness against the Delta variant, and just coincidentally as well. Okay, what a lot of people don't realize is the Delta variant comes from India. In fact, I don't know whether you noticed, originally you had place names for all these variants. Brazil variant la, South Africa variant la, depending on where it came from, but then it became much of contention, meaning it became like in countries, various countries, like people started like having issues with people who came from a certain area because they said, oh, I absolutely cannot come near you because you may have this variant. It's like super illogical, but yeah. So but since we're on it, the Delta variant actually is originally from India. It's an Indian kind of variant of concern, which emerged first in the Indian subcontinent. And what a lot of people don't realize is Astra is the largest vaccine being used in India, using the brand name Covishield. And you'll be really surprised, Maisie, we're looking at something like about, if I'm up to my numbers, my numbers is maybe about 2 weeks behind. I haven't updated my Indian statistics, but about 200 over million doses of Astra was given,
Okay.
Not small number, not like some kway teow, 500,000 or million. 200 over million doses have been used, Covishield, in India. And when they used that much, you remember India, say a couple of weeks ago, we were all laughing in India, oh, so bad, blah, blah, blah. Bro, the numbers drop in the numbers. So obviously, even in a country where you technically have very high amounts of Delta variant, your vaccines are working. If not, the numbers will not come down. It's very simple mathematics.
Okay.
Right?
So the vaccines are working.
Yeah.
Okay, against the Delta variant. So I think that is a very important thing to note as well to all of you watching. And I know that some of you watching may still refuse to take the vaccine, but I think this messaging over the past few questions have been very clear from Dr. Muralli. Go and take the vaccines, whatever vaccines it is, as long as it's injected into your arm, there's already a layer of protection that against especially the variant of concern that it is increasing in Malaysia. So Dr. Muralli, I'm going to start asking questions on behalf of the public. I'll jump straight to the questions that they have.
Okay,
So
sure.
Jade says,
I'm sorry. I'm sorry. I just wanted to kind of add, just in case this question doesn't come up. Yeah, could I just do that
yes,
before we
yes,
go
go
into
ahead.
that set of questions? Now, what a lot of people are concerned about is whether, oh, should I take the vaccine? It may not be effective against the Delta variant. I've got an even more worrying thing to share with you. Look, the Delta variant is not going to be the last mutation.
Yeah,
And a lot of people are not are quite unaware of that. So as much as we want to live, we're human beings, we want to live, we have try our best not to die, right? We try everything in our world, like get ICU, like get
yeah,
treatment, like get expensive antibiotics, right? We try not to die. Similarly, the virus is a live organism as well, so and it tries not to die as well. So every time it's challenged, whether it's by a vaccine or it's by masks, which is why the variants evolve to, like, oh, they become more stronger to be airborne, because right, they know you're putting on masks to stop it from spreading. The virus tries to evolve to overcome that challenge. So because the viruses, their only objective is they want to live, so they will try their best to live. So as much as our vaccines get better, we start vaccinating more and all that, I foresee we'll see at least, I don't know, 5 or 6 more mutations, so 5 or 6 more variants of concern. And the kind of important message is, if at one point your vaccine protection does break down, okay, that's where science comes into play. All it will then take is for us to mutate our vaccines, like mutate in the sense that, we reconfigure our vaccines, people get a booster shot, and that's how we overcome the virus. We got 6 billion brains working against one cellular organism. We'll definitely win. But it's when people just don't believe in the science, which we have, doing everything like running your computer, switching on your lights, everything is due to science, right? But when you don't want to believe it, it's very difficult.
okay. Thank you so much for sharing that. So, guys, it's important that we get the vaccine, get the booster shots when it's available, because, like Dr. Muralli says, that it will mutate more than the Delta variant, and we don't know what's coming next. So, Dr. Muralli, I'm going to start asking questions now from the public. There's so
Sure.
many. So Jade asked, she says she's very disappointed that all our vaccines except Pfizer, they are not recognized by the EU. So I don't know whether you can answer that question.
Boss, it's not political discussion lah. But no, I mean, honestly, Jade, I wouldn't be too concerned about it, right? Because you see, again, this is probably a kind of different perspective on things. Europe is no longer the Europe we knew it to be. Okay, in the 1940s, 1950s, Europe is all powerful. There's nothing you can do without like some Angmo giving the signal or giving you the agreement to go ahead, right? Today, Asia is a power in its own right. And not only Asia in an individual country, you've got India, which is a superpower, China is a superpower, and the rest of South Korea, Japan, and all that. So when EU says it doesn't want to recognize vaccines from South Korea or say, for example, China or Japan, which is where our, for example, Astra is coming from now, right? And they're saying they're not recognizing the Astra from South Korea and Japan. All it needs is for Japan to say, turn off the lights, as in like, they stop sending stuff to Europe. How long is that going to run? Maybe 5 days, 6 days? Or South Korea to switch off, Samsung technology to Europe. These are things that are no more. The world is so globalized now. This place cannot close off all the borders. So mark my words. Give it about a week or two. They'll all capitalize. Now all trying to show macho, but they'll all just back down after a couple of days.
Okay, thank you so much for sharing your thoughts on that, Dr. Muralli. So Kathleen's asked, she's still undergoing monthly maintenance therapy with bevacizumab. Can she take the vaccine?
Yes, ma'am. Not an issue at all.
Okay, so Sunny's question is that, he has been reading a lot of negative things on Sinovac. And at first, he didn't believe in vaccines, but in the end, because of our number of cases, he went to get vaccinated. So because he read so many negative things and countries don't recognize like Sinovac, he was asking what should we take. Some say anything will be good. But Sunny, if you live in Malaysia, I don't think you can choose, right? The vaccine.
Yeah, that's an issue at this point in time, meaning you have no choice. So, right, I would tell Sunny, hey, get whatever is taken. I think later, sooner, they will open up a private market or so. And that time we can talk about maybe boosters. You can get whatever brands make you most comfortable. Okay, I am obligated to kind of speak up and defend Sinovac, not for anything, because based just on the data. Okay, and the data is very clear that all the vaccines, okay, limit you from getting severe COVID and limit you from dying.
Yeah.
So at that, they're all 100% efficacious. It seems to be no difference between the brands. So having talked about that, so it's why we are brave enough to kind of recommend any vaccine. All the vaccines are equal, and trust me, I don't think our government is that cruel as well, in the sense that we want to get things working. And if you notice, there's some vaccines that even though there's a lot of hype about it, advertising about it, we still haven't got the approvals for them to be used in Malaysia, simply because that means the government is not convinced of the data, and that needs to show a kind of strong signal to Sunny as well. So to Sunny, maybe, bro, don't worry, whatever vaccine already got, it's good. And later, if I'm using a big if and when you need to get boosters, at that time I think there'll be like kind of a private market for you to be able to choose what vaccine you want, But data driven, all vaccines are about the same.
Good to hear. So, Dr. Muralli, Wignesh Worry asks, is it safe to undergo local anesthesia after first dose of Sinovac vaccine? Because she's going for tooth filling.
Oh, absolutely. No issue whatsoever.
Okay. And William says that how come there's no vaccine to address the Corona Delta variant? But there is. So most vaccines are pretty effective against the Delta variant, right?
Yeah. I was telling we spoke about this slightly earlier.
Yeah.
So since the current vaccines seem to work and work well enough, at least, so there's no reason for us to kind of re-engineer a new set of vaccines as yet.
Yeah.
But however, and maybe, sorry, just to kind of interject,
go ahead.
Easy. I forgot to kind of put this out on the table, right? The longer you keep the population, okay, not getting vaccinated, okay, and these variants kind of spreading around, that's exactly how mutations happen, right?
Yeah.
So,
true.
Because when people don't get vaccinated, okay, when people don't social distance and all that, the virus spreads from one individual to another. And during that transmission process, it's when the mutations get passed on. If the Delta mutation, for example, happens in me, and I get healed, I do not pass it on to anyone else, the Delta variant will actually die with me. It doesn't get into the population. So the more you stop transmission, and one of the effective ways of stopping transmission is vaccination. The more you vaccinate, the more everybody's happy.
Yeah, that's true. Now, Joycelyn asks, someone says that if you don't have any side effects, that means the vaccine is not effective in our bodies. Is that true?
Oh, okay. So this is, I suppose, a joke that happened to me personally as well. So when I got the first Pfizer shot, right, I was having the same concern. I didn't have anything, man. I had it at about 11, 10 in the morning. Came back, continued working whole day until about 9:30, 10 at night. Absolutely nothing. And then everybody else in the office, like Peng San la, Chuti 1 day la, MC 2 days la, all. So I was exactly having the kind of same concerns as Jocelyn. It's just like, oh wow, was this? Did they inject me with warm water or something? But no, but that's really a joke. Second shot, I was out cold. So as I was telling you earlier, it's very individually driven. Some people have reactions, some people just don't. Doesn't mean that you're not getting a response, an overt response like side effects, fever or whatever. It doesn't mean that the vaccine doesn't work.
Okay. And JC asked, what are the ways for us to check our antibody response after getting the vaccine? And how likely are we needed to do a yearly or follow-up booster shot?
Okay, so two questions on that. So the first is you can actually get an antibody titer level now. I know there is a diagnostic kit we just developed together with I think the Ministry of Science and Technology. If I'm not mistaken, it's called ImmuSafe. Many private hospitals already have it. It's not cheap though. I think you're looking at about $400 or $500, and you usually get it about a month after your second dose. That'll really show whether you have adequate antibodies or not. Now, before you spend the 500 ringgit, and I'll always be very happy to share my bank account number in case you want to spend 500 ringgit, you donate it to me personally, not even the National Cancer Society. No, I'm kidding. I have to share with you global data. So global data says actually about 98 point something odd percent of more than 1 million people who were vaccinated in all these big clinical trials had immune response, more than adequate immune response. So unless you're really within that 1% who don't have antibodies after your 2 doses, memang ada, bukan tak ada, but it's less than 1% lah. So I would kind of keep that data in mind before you go and actually kind of periodically want to check your antibodies lah. It's quite a waste of money. Having said that, yeah, like I said, the test exists. Now, do we need to get our booster shot after a year? Now, I've got good data to show you. There's a new clinical trial that came out, just published in Nature, and that actually shows a cohort population. So there's actually running populations in which they test these antibodies as part of like ongoing trials where these people have been vaccinated and then every month go and chucho them again to see, hey, got antibody or not, hey, got antibody or not, hey, got antibody or not. So what's good is in this clinical trial which just got published, these people had adequate antibodies at a year. So until about a year, we know antibody cukup. So we're still following them up. They're like our test cohort lah. So when they start showing a lowering of antibodies, that's when we will know, okay, we need booster shots, maybe 18 months, or 24 months, whatever.
Okay. Thanks for sharing that, Dr. Muralli. That's really eye-opening. So next, Eric asks, if one is tested to have high blood pressure, 145/102 on day of vaccination, can the vaccination still be taken?
Okay, so my kind of advice is to Mr. Eric is, and a lot of people, I don't know why, they've been told that don't take their medication on the day of vaccine. Do not believe this shit. It's fake. Please take all your medications because this is the problem. By itself, you having a high BP will not cause you to get rejected for vaccination. But let's say you get vaccinated and unfortunately you're one of those people who have, say, dizziness or headache or something, right after getting vaccinated, with a high BP, you're definitely going to have a worse kind of set of things that have happened to you. So I would say, stabilize the BP, make sure you're relaxed and all that, make sure the BP is a bit low, and then go for the vaccine if you're calm and you think that things are okay. Okay, so that's really about it. Of course, not forgetting that if you're ill, meaning you've got fever, flu, cough, diarrhea, stomach ache, that kind of thing, you need to wait 2 weeks, before going for the vaccine. Any vaccine, that is.
So next question is, Madam Yeo says that if you have little or no side effects from the first dose, can one assume that you will also have little or no side effects for the second dose? That's not true, right?
No. I was just telling you a living example of first dose tak ada apa-apa, second dose sudah pingsan. And in most of your mRNA and Astra, your viral vector vaccines, the second dose is worse. Your tendency to get a side effect is higher in the second dose.
Okay. And Mr. Paul Lim asks, one of his workers tested negative for COVID, but on retesting 5 days later, he was tested positive. How do you explain this? What is the time frame required between testings?
Sure. So this is the real problem with these testings. Okay, your testing is accurate at the time you take the swab. That's it. So at the time you take your swab, you're negative. You walk out of the testing room, somebody coughs in your face, and you get COVID. Nothing. Your test is not reflective of that at all. So possibly for this colleague of his that got positive 5 days after, it's for sure that after maybe 1 or 2 days after testing, he got exposed to someone with COVID and then subsequently did get COVID.
I see. Okay. I think the next question is Zach Hamid asks, what is happening to Singapore's COVID-19 test that uses breathing into the test kit to check whether
Oh
you have
yeah,
COVID?
yeah. They've got a interesting kit. I know they're trying to get it into Malaysia as well, and that's coming, sir. So now there's a deep saliva kit as well. I know there's a couple of tests that are coming to house, so you can do it's like a do-it-yourself COVID test at home. So that's coming into Malaysia as well. Again, the blessing or the ingenuity of science, I suppose, as quickly as we can create tests that are cheaper and cheaper, we're
Yeah.
doing that, and
So
that's actually coming into use. So
okay.
I know the Singaporean one, the breath test, is coming into Malaysia. There's even a Dubai one now, which is very interesting. It's got a phone app, and that phone app actually can pick up the kind of viral particles in the kind
Wow.
of um,
Interesting.
magnetic change. So they use it when you walk past, and that actually can detect COVID-19 RNA, apparently. But
Wow.
they've got a clinical trial work, so they're deploying it in the Middle East.
Wow, that's very interesting. Okay, good to know. Okay, Dr. Muralli, I asked two more questions before we close the session. I know there's tons of questions. Thank you all for staying tuned. Sharon To says that she does not dare to jab as she has fear of fever and chills that may lead to fits. She's allergic to NSAIDs. So no medication to take. Please advise.
Okay, Ma. So now, very interesting. So if you have an allergy to NSAID, first question is, will that cause you to be allergic to the vaccine? That's the first question I would ask. Okay. Now we've categorically now found out. Again, you can Google this, and there's quite a bit of data to say that people with NSAID allergy have got no problem with the vaccine, so they can take the vaccine. Now, good question that you ask, which is, okay, let's say I do take the vaccine and I get fever, and I'm allergic to NSAIDs. How do I manage the fever? Okay, so generally, and really, since I don't know you as a patient, I don't know this history, people who are allergic to NSAIDs are not generally allergic to paracetamol. Okay, so there are people who are allergic to both. Okay, but some quite a few of my patients, especially, they're allergic to, like say, your Voltron, Constant, that group of NSAIDs, but they're not so allergic to acetaminophen,
Yeah.
your paracetamol. Okay, which also can be used to control fever. Okay, and if that doesn't work, there's actually many other medications not from the NSAID group that can also be used to control fever. So I suggest have a discussion with your doctor, see which is suitable, go with that, just get that, and use that right after your vaccination. In fact, I sometimes tell quite a lot of people to take a dose before they get vaccinated, or paracetamol or whatever it is, not an NSAID, but anything else to kind of keep them stable right after.
Okay.
So don't be afraid of that, and kind of not get vaccinated because of that.
Okay, so I know there are a few more questions from you guys. I'll take what is important first, because I think some related to medical advice, I would actually take those first. So Eric Wong says he had hepatitis A vaccine on 25th of January. His next dose is 26th of July, which is 3 days after his second COVID-19 vaccine on 23rd of July. He asked for advice. Is it okay?
Okay, so generally, Eric, we're saying space between 2 weeks lah. Space out your vaccines at least about 2 weeks between doses. Okay, whatever type of vaccine. So I would say that your hepatitis A, I think you're saying hepatitis A or hepatitis B.
Hepatitis
Okay, whatever
A.
it was, your hepatitis A. Okay, that can go maybe about a week or two. It's not like, how to say, super rigidly timed lah. So I would say go for your COVID vaccine, wait about 2 weeks, and then get your hepatitis lah.
Okay, I'll take one last question. This is about the AZ second dosage, which apparently was supposed to be 3 months. Why is it now 2 months? There is no difference?
Okay, and I'll tell you why is this, yeah? Okay, so originally, if you notice, AZ was, you see the WHO recommendation for AZ is 8 weeks to 12 weeks between the first and second dose, okay? They give you a interval. Why the interval is 8 to 12 weeks is between this interval, okay, you can see different efficacies. And we know that with the AZ, when you wait till about 12 weeks, you get your highest efficacy. Okay, so now that, which is why we fixed the 12 weeks. Now, why are we bringing it down? Okay, simply because of this. With so much of COVID spread within the community, okay, it is now the benefit of making you wait 12 weeks to get your second dose versus the risk of you getting COVID with that minimal protection from the first dose, with like 7,000 cases of COVID in the community every day. Okay, the government, fairly enough, is deciding like, look, I cannot afford to give you the benefit of waiting for the second dose at 12 weeks because I'm scared you will get COVID in between. And with the first dose of AZ, I think you get something like 30 something odd % protection. So myself, I bring it shorter, I tembak you so that I know at least then your risk is much decreased. So that's why that's the decision that's being taken.
Okay. Thanks a lot, Dr. Muralli. I know a lot of you have questions that you have certain diseases like heart diseases and stuff like that on whether you should take the vaccine. If you join us at the earlier session, you would know that any diseases that you have, you should take the vaccine because like what Dr. Muralli mentioned, in terms of statistics, people with comorbidities are at higher risk of getting COVID-19 and having a higher risk of being intubated or even being in ICU. So please go and take the vaccines. I'm all for it because I believe vaccine saves lives, and I think Dr. Muralli has mentioned it throughout today's session. So thank you so much for all of your questions. I apologize that we cannot take all because Dr. Muralli is still working on a Sunday. He is actually going on the ground to actually deploy vaccines to people. I think his first destination will be Hulu Langat tomorrow or something like that. So we should all wish him well. Yeah, and the National Cancer Society of Malaysia as well for supporting the vaccine drive in Malaysia. And also for you who are tuning in from Singapore, from Indonesia, you guys have similar vaccines to us in Malaysia. So thank you for joining us, staying tuned, and also understanding more about vaccines. So please share this with your friends, family, and on your social media to get them to start taking the vaccines. Thank you so much. And more importantly, thank you so much, Dr. Muralli, for joining us today. It has been very insightful and informative.
Thank you so much. Always a pleasure. Take care, guys. Stay safe. And please get vaccinated, man.
Yes. Thank you so much, everyone. Have a good day. Have a happy Sunday and stay safe. Bye.
Bye.